Good morning, good afternoon, good evening from wherever you are watching, or if you're watching the recording for this event. Our event today is entitled World Environment Day, Advancing Pharmacy for a More Sustainable World. Thank you so much for joining. My name is Ruben Viegas. I'm Sustainability and Humanitarian Program Manager, and I'll be moderating the session for today. Just a few announcements before we start. This webinar is being recorded and live streamed via YouTube. This recording will then be available in our website, events.fip.org. You may ask questions using the question box. There's also the chat box where you can say hi and your greetings and what are your favorite environment topics. But for the questions, especially if you want to address them at some of the speakers, please use the question box so they can provide an answer as well directly to you. You can provide feedback at webinars@fip.org. And if you're not a member of FIP, you can find out how to become a member in our webpage. So today we have a fantastic panel of experts that will join us from different points of the world. And we would like to sincerely thank them for the time and the expertise that they bring to this important topic on the area of sustainability. And we'll just squeeze as much as we can a lot of questions from them and information on sustainability, on the environment, and all related aspects. So thank you so much again for joining. Just a note that today, 5th of June, is World Environment Day. So if you go to the United Nations Environment Program, you'll see there's a big campaign and they have a lot of resources focusing on this area. And this year's topics is land restoration, desertification, and drought resilience. And we know this is important, and we'll see, as the experts will also explain, that we're increasingly seeing a lot of natural disasters resulting on the changes that we're seeing in our environment, in our climate. So it's quite important, if you're interested in this area, that you can follow the United Nations Environment Program, as they'll have a lot of resources. And I just brought one of these resources, which is this practical guide that is quite interesting with the motto, "We are #Generation Restoration." So it focuses on the topic, as I said before. So for today, we have the welcome that I'm doing right now. Then we'll have sustainability program overview by our colleague Hanadi. Then keynote presentations by the FIP DG21 leads. And if you're not familiar with the development goals, they will also be explained. And finally, we'll go through a moderated discussion with Q&A and a short wrap-up and conclusion at the end. Again, we encourage you to write your questions during the session so we can take note of those. The objectives is to highlight the role of pharmacists on the mitigation and reduction of environmental impact of the sector, the pharmaceutical sector, explore the impact of our environmental policies on sustainable pharmacy practice, and understand how we can promote sustainability in our sector. And without further ado, I'll hand over to Hanadi Alolimi. She is the FIP Equity, Humanitarian and Sustainability Projects Coordinator, and she will guide us through the Sustainability RX, our sustainability program. Hanadi, the floor is yours. Thank you.
Thank you so much, Ruben, for introducing me. Welcome everyone who has joined us from all around the world. Thank you for joining us in this important event to recognize World Environment Day. My name is Hanadi Alolimi. I am Equity, Humanitarian and Sustainability Projects Coordinator at FIP. In this presentation, I will provide an overview of the Sustainability RX program and the FIP development goal underpinning this program. I will also provide a brief description of the different program areas. Next slide, please, Ruben. Thank you. First of all, we cannot think of a future without adopting a sustainable approach. As you are aware, the Sustainable Development Goals have sustainability at their core. If we have significant advances and initiatives or program in pharmacy, if these are not sustainable over time, they will ultimately lose the outcomes and profit that these initiatives can achieve. So for this reason, FIP for 2024 has identified 12 priority programs that link to global health priority or professional priorities. Sustainability in pharmacy links to professional priorities and is one of the main programs for 2025. FIP Sustainability RX is part of the RX family of programs along with the Humanity RX and Equity RX. The RX suffix is there because we see it as our prescription to the world, a call to action for leveraging pharmacists to advance sustainability in pharmacy. Equity, sustainability, and humanity are interconnected, and therefore our three RX programs, Sustainability RX, Equity RX, and Humanity RX, are also interwoven and are aligned with our mission, guiding our efforts to build a world that is not only more sustainable and equitable, but fundamentally more human. In the next slide, thinking about the future, FIB identified one of the 21 Sustainable Development Goals, specifically FIB Development Goal 21, Sustainability in Pharmacy. This important goal is one of the main goals that links to all of the other FIB goals as we move forward in advancing pharmacy practice, science, and education. Also, this goal is not limited to environmental issues alone, but also cover economic, social aspects, which we will explore in the next slides. Therefore, we need to consider sustainability across different areas of the workforce, practice, and science, looking for a holistic and integrated approach to cover all of these areas. In the next slide, FIP Sustainability RX is a comprehensive initiative that focuses on three main programs: environmental sustainability, economic sustainability, and social sustainability. It examines the intersection of these pillars to ensure the long-term viability and positive impact of the pharmacy profession. So in this slide, I will present for you the first program area, which is environmental sustainability. Our aim in this program area is to protect the environment and mitigate the health effects of climate change, and these affects pharmacy. To achieve this, we have objectives as we will educate pharmacists about their role in protecting these issues, create a network for experts and pharmacy initiatives, support policy development, and advocate for the profession nationally, regionally, and globally. In the second program area, the next slide, is economic sustainability. And our aim is to support the sustainability of the profession in terms of service delivery. Even if we have amazing services, if those are not adequately remunerated, then we don't have a sustainable model for the profession. To achieve this, we will identify the enablers and barriers to sustainable professional services. We will examine the role of service remuneration in economic sustainability of pharmacy. And lastly, we will support members with developing policies and tools. The last program area of work in this in the Sustainability RX program is social sustainability. Our aim is to address the aspect of social responsibility by pharmacy, and to achieve this goal, we will enable community-based care through pharmacy and support workforce. Explore the relevance of social accountability in pharmacy, empower self-care and caregivers to widen access to health, and explore links with climate adaptation. So this is a new arm of Sustainability RX, forms part of the 24 FIP plan, focusing on the social dimension of sustainability in pharmacy. So in conclusion, by addressing these key areas, we can ensure the long-term viability of pharmacy services and contribute to a more sustainable healthcare system. In the last slide, if you require any further information about the Sustainability RX program, you can visit the Sustainability RX microsite, which is available at sustainability.fib.org. Thank you so much for listening, and over to you, Ruben, to present our great panelists. Thank you.
Thank you so much, Hanadi. And it's very important to note that today we're focusing on the environmental sustainability, but that sustainability is a broader concept and is the future of our profession is linked, deeply linked with sustainability. And again, you can visit this webpage, and if you have any questions, you can also find our contacts there. Thank you so much, Hanadi, for a very nice presentation. So moving on, these are our panelists. So we'll start with the keynote presentation from Chaliza and Shima, and I'll present them briefly at each point. Then for the discussion, we'll have Mina A, Naoko Arakawa, and Angelina Lim that will also provide some answers to the questions, and we'll have a good discussion. But before that, we'll have our keynote presentation, so we have a bit of the understanding of the main issues that focus climate change, climate adaptation, that focus on environmental sustainability. So I'll start with Chaliza. I'll ask Hanadi to post in the chat box the full bio, but you can already see that Chaliza is a very renowned expert. She's co-lead for the FIP DG21, Development Goal 21. She's an adjunct professor in the University of Ottawa, co-chair of the Canadian Association of Pharmacy for the Environment, and also president of the Pharmaceutics Health Solutions and Clinical Pharmacy in Ottawa Hospital. So thank you so much, Chaliza, for bringing all this knowledge to this event, and the floor is yours.
Thank you so much, Ruben, and thank you so much to the wider FIP team for having me and having this great, I feel very honored to be part of this great team of panelists here today. Next slide, please. And you can keep going. Okay, so before we get into environmental sustainability more broadly, I thought, every talk that includes climate change includes, a couple of pictures, and I feel that we're now no stranger to these pictures. Some of these pictures are specifically from my own country of Canada, although we will be talking about sustainability and climate, especially more broadly as well. So you can see the wildfires. There was a heat dome that happened a couple of years ago, or a few years ago in BC that, within 1 week, almost 700 people passed away. We can see the impacts of flooding at various parts of the country. And I just wanted, especially for this particular presentation, it's very important to emphasize that, climate change is not necessarily specifically a future problem. It's not a problem that necessarily is only impacting certain countries. It's impacting every country. It's a global issue, and it is certainly impacting certain countries and certain communities even more than others. And we need to think about that when we think about climate adaptation and resilience. And we also need to think about that when we're thinking about the reduction of emissions, because certainly, although every country contributes to emissions, some countries, of course, certainly do contribute more than others. And therefore, when we're thinking about climate change, we really need to take that nuanced approach when we're thinking about, I can see the variation of countries that are represented today. So certainly something that's very important for today. Next slide, please. So a few things that we'll be talking about. So when we think about climate change in particular, we often divide it between mitigation and adaptation. And what that means is mitigation is looking at the reduction of emissions, and adaptation is looking at, how do you improve the resilience of pharmacy services? How can I protect my healthcare system? How can I protect my pharmacy from the effects specifically of climate change? Wider to environmental sustainability, we also have the impacts of pollution more broadly. So this is examples of this include pharmaceutical pollution. So this is when medications, for example, are in the wastewater, and plastic pollution when we are right away impacted by the impacts of plastic on health. And then big considerations with regards to inequities. I wanted to also emphasize that economic sustainability and social sustainability are relevant throughout all of these different categories as well. because reducing emissions is economically the right thing to do as well, because climate change is a very, very expensive issue. It causes a lot of problems with regards to impact on health, which then causes emissions as well. And then adaptation, of course, with regards to disaster planning in particular, something that's very, very important to economic sustainability as well as social sustainability. So you can see this little think bubble here. And some of you might be thinking, I mean, we're pharmacists. Is this really important for us? Is this something that is really in our lane as pharmacy professionals more broadly, as pharmacists, as pharmacy technicians? And hopefully we'll be able to challenge that a little bit during this presentation and during the panelist discussion. It's interesting, some people, when we're just introducing for the first time, think that we have longer time to wait, and some actually think that, oh no, it's actually too late because we can see the effects of climate all around us. And the one thing I would emphasize right now is to say that actually this is a time of urgency, and this is a time of opportunity, that it's not too late specifically to work on climate change and the other areas as well. Next slide, please. So this is related to pollution more broadly. And remember, if climate change is related to emissions specifically, and greenhouse gas emissions and global warming, pollution can also cause impacts to health as well. So a really good example of this is that if you have antibiotics, and if they are in the rivers and in the wastewater, that is a big threat to antimicrobial stewardship, because you have people who are ingesting those medications in low levels, and then that causes impacts to antimicrobial resistance. Another impact specifically is on thinking about the direct health impacts of plastic. So this is, again, when we're ingesting plastic, what are the different health specific outcomes related to that? But I want to emphasize that this is related to pollution more broadly, and medications can also have an impact on climate change, and that is a separate, we consider that as a separate, indirectly linked, but separate issue. Next slide. With climate change more broadly, we're not typically taught about this in pharmacy school, although that is starting to change with different pharmacy schools doing different types of work around the world now. So basically, we emit greenhouse gases. They trap the sun's heat, and it's almost as if we are putting on a coat, like we're adding a really big heavy coat to the world, and because we're trapping the sun's heat, the temperature rises, and the temperature rising causes a whole host of effects that have impact on health. Next slide. So again, as I mentioned earlier, the IPCC has mentioned that we can act on climate change, but time is running out. So this is not necessarily a future, just a future issue. This is an issue that we need to work on right now, and positive things have started to happen in the space. You can see various innovative technologies that are now being funded, and the political interest to look at climate is clearly growing. But in order to be successful, we need to be successful specifically within this, we need to have goals targeted towards this decade and not necessarily many future decades. One thing that might make you really interested about pharmacy in particular as it relates to this is that if we think about the entire global airline industry, and we compare all of the emissions associated to all the flights and the entire airline industry, and we compare that to the healthcare sector and the entire global healthcare sector, the healthcare system actually has a much higher emissions burden than the airline industry. And medications count for about a quarter of that. Now, the estimations of that change country to country. Certain countries have a higher even healthcare sector emissions compared to other countries. But this is basically the case for being able to work on emission reduction, specifically within the healthcare sector. Next slide, please. So as this is the takeaway from the World Meteorological Organization Secretary General, that we're not yet on track towards the Paris 1.5 to 2 degree limit, but positive things have started to happen. And again, really focusing in on action within this decade. Next slide, please. So this is the impact of climate change specifically to health. And when you think about the mechanisms, it actually makes a lot of sense. If there's specific slides that I would recommend really kind of maybe taking a picture of or just having this in your toolbox, this is one of them. So I know that this presentation is also being recorded. So if we think about the impacts of climate change on health, we start off with, on the left-hand side, we know that increased risks of increased severity of, let's say, extreme heat events can cause worsened cardiovascular morbidity and mortality. And therefore, we really need to be watching out for this when we have extreme heat events. And this is particularly relevant now that we're in the summer. The other areas, when we have changes in temperature and changes in precipitation, we also have changes in incidence and prevalence of certain infectious diseases. So, you can see several infectious diseases listed here, and this is very different according to geographical area. So I had done some global health work in East Africa, and I had noticed on a kind of a graph, I noticed that kind of the increased incidence of malaria up a mountain. And the reason is because the temperatures closer up towards increasing kind of as you went up the mountain were becoming more and more kind of suitable for the mosquito to still survive. And so the one thing important to realize here is that it basically means changing prevalence and incidence. So you have to kind of look according to your own country as to what is what are the anticipated effects in your country. Another area, I'm just going to pull on one more. I think civil conflict is a really important one, specifically during these times. So climate can increase the risk of climate migration, which also has, you also then have instability, and then you also have increased risk of civil conflict related to various areas. So, for example, if you don't have good economic sustainability from a global workforce perspective, even outside of pharmacy, and you have increased risk of increased unemployment, and you're basically increasing your risk of civil conflict, and then because of that, you will have health effects that way as well. And then climate migration can also cause issues with regards to accessing healthcare systems, and of course, extreme weather events itself also cause impacts on mental health as well. So one thing to remember here throughout this entire big chart is that access to the healthcare system is also really compromised during extreme weather events. So regardless of where you are at in this diagram, when you have an extreme weather event, you're also affected because the access to the healthcare system is also impacted, and that can be reduced by disaster planning as well. Next slide, please. So this is just an example, considering that this is more of a global presentation. South Asia specifically is very also dear to my heart, and you can see that the heat wave mortality has actually been increasing quite a bit related to extreme heat events over the last about 20 years or so. And I feel like this is kind of happening now in real time when we think about the impacts of heat events that have, even in recent years, this diagram only goes to 2020, but I feel like in recent years, we've really been able to see the impact of heat events on mortality specifically. And the reason why I bring up this slide specifically is that each country's kind of experience with climate is going to also be different depending on within the country, what are the specific climate hazards geographically in various areas of the country. What are the typical health threats that already exist? What is the country's own capacity from a healthcare system perspective, and what is the healthcare system like within a country? So if you're looking to understand a little bit more about your own country's impact with regards to climate change on health, in order to better prepare your own healthcare system, I would recommend just searching up, your country and then climate change and health. And that would really be able to Google this, and there are some UN resources that are there, and then you can easily extrapolate that from that to understand the impact specifically on pharmacy within your own country as well. So this is really useful because then you can help, it helps prepare for challenges as well. Next slide, please. So a quick overview, again, greenhouse gases causing a lot of challenges, and the WHO is reporting that these challenges are likely to worsen. In Canada as well, we also have a lot of deaths that are just related to specifically air pollution, so outside of climate specifically, but air pollution more specifically. And we know that children, elderly, and those with pre-existing conditions are also very vulnerable too, along with specific populations that are even more at risk, more than others within a particular population. So next slide, please. Thank you.
Thank you, Shaliza, for this interesting overview and presentation. I got a note on climate change is a very expensive issue. I really like that, because when we think of climate change, maybe we only think of the. We normally only think of the climate effects, but maybe there's also economic, social effects, as you described, and also the links to other areas that FIP is working, such as humanitarian issues or access to healthcare equity. Those are also programs under FIP. And to continue the presentation, Shima, welcome. Shima is a FIP Global Lead on Sustainability, so it's a DG21 lead. No further introductions needed. Shima, the expert, thank you so much for joining, and the floor is yours.
Thank you, Ruben. Thank you, dear colleagues, for inviting me. It's an honor to be here to share my views and be part of providing this keynote address. Thank you. Next slide, please. So my colleague Shaliza has mentioned a little bit about climate mitigation and adaptation and what it means. So the big question now we need to ask ourselves at pharmacists is, what is our role in all of this? A lot of us live in the global north, and of course, a lot of us live in the global south as well. So that's the big question we'll have to ask ourselves. What is our role in this whole issue of climate crisis, and how best can we help to ensure that our regions and wherever we work in, we mitigate climate, that is in the case of the global north, and for example, in the global south and some other vulnerable areas, that we adapt our healthcare system and our mode of practice and our way of practice to adapt towards climate. And of course, there are also other areas we have to look at, planetary health, and how do we make our planet overall, the environment, today's World Environment Day, make it healthy, and how best can we address pharmaceutical and plastic pollution outside of climate change. This is very critical for those of us in industry, in community pharmacy and hospital pharmacy. So the next slide will give us more answers to that question. So for climate mitigation, again, climate mitigation are talking about how to reduce the impact of climate within our healthcare system. So these are like some of the points we can consider in our area of practice. So one of them here is sustainable procurement and reducing plastic. So in terms of our procurement, in terms of, for example, the APIs we use in industries, the excipients we use, we need to kind of source for sustainable products, sustainable materials for our manufacturing. In the packaging space, in terms of the packaging like plastics, we need to think of, are there sustainable ways, are there more climate-friendly materials we use instead of plastics to reduce the impact of climate in our environment. So for again, you see an issue of medication use, anesthetic gases, and inhalers. So this also applies like in hospital practice, in hospital pharmacy, for example. We're thinking about what kind of asking the question of what kind of anesthetic and inhalers we should be prescribing to our patients, and what is the impact on our environment. So we need to kind of have like a climate evaluation of our anesthetics and our inhalers, and choose the appropriate ones that will have limited impact in the climate. Building materials and energy. So for some of us who want to construct new community pharmacies or construct new hospitals or industries, we also have to consider what's the building materials we are using, how climate friendly, how environmental friendly are these building materials whenever we want to build a pharmacy, a community pharmacy store, a hospital, as the case may be. So we need to start having those conversations around that as well. Now, operational is very, very important. So how does our day-to-day operation of pharmacy in our pharmacies or in our areas of practice affect climate? So in terms of ranging from safe disposal of waste, how we reduce emissions in the area of practice. So we really need to factor in all these areas of areas of practice to if we are to be serious, if we are to be effective as pharmacists and as healthcare professionals in climate mitigation. Remember, the Gallup poll says that pharmacists are always at the top of the most trusted healthcare professionals in the world. So it's very, very important, because if the public puts this trust on us, it's very important for us to lead the way in things like this, in saving the environment and making our healthcare system more sustainable. Next slide, please. So this is a typical example of hospital pharmacy, which I just mentioned a little bit in the previous slide. So this is like a more detailed or comprehensive example of what we can do to mitigate for climate mitigation in our hospital pharmacies. So I've mentioned earlier about anesthetic gas review. So we need to have like a comprehensive review of the anesthetics we use either for surgery or as the case might be, ensuring that we use the best possible option that is better for the environment and that will reduce the impact of climate in our healthcare system and environment as well. Then we need to also consider deep prescribing, right? So we talk about a lot of polypharmacy, prescribing lots of drugs. So we also want to ask our questions, are some of these products we are prescribing necessary? We need to have a comprehensive review, because the more drugs you prescribe, the more polypharmacy there is, the more drugs, unnecessary drugs, thereby you are having more wastage of medicines. And when you have more wastage of medicines, you're also increasing chances of poor disposal of these medicines, which will now in turn harm the environment. So it's very important for us to ask our questions, have a root cause analysis of why we are dispensing these drugs, and also understanding how the impact of whatever we are doing is with the environment. They were talking about metered dose inhalers, which has been found to contribute significantly to gas emissions. So we have to understand what are the alternatives to metered dose inhalers, and are they clinically appropriate? So it's more like whatever aspect of hospital pharmacy we are trying to do, we have to consider the climate in every aspect. So I've already mentioned earlier about sustainable procurement and reducing plastic, and of course medication use as well. So here you see where I mentioned about aerosol inhalers and how they have a carbon footprint comparatively to somebody driving 170 kilometers per hour. So I think that's really something we need to consider, and let it sink in for a while to understand how the impact of our choices has on the environment. Next slide, please, Ruben. So a typical example of supply chain management, which is very, very important in this issue of climate and environment. So a typical example here is for those of us in the UK, example from the NHS. So from April 2022, NHS procurement will include a 10% reduction net zero, a minimum of 10% net zero and social value weighting. So the net zero and social value guidance for NHS will help unlock specific health outcomes. So again, April 2023, which is last year, so all contracts above £5 million The NHS will require suppliers to publish a carbon reduction plan for the UK Scope 1 and 2 emissions as a minimum. So the NHS here is actually taking a lead role in terms of trying to reduce gaseous emissions and trying to mitigate the impact of climate in the environment and in the healthcare system. And remember, NHS is one of the biggest healthcare system in the world, and of course in the UK as well. So I think this is something that other countries can also emulate and even do better than what the NHS is doing. Although I believe there's always room for improvement, but this is like a typical example of the NHS and what we can advocate for in our respective countries or area of practice to be implemented. Next slide, please. So we mentioned about mitigation previously. So now a little bit about adaptation. So for adaptation, we're trying to reduce the kind of reposition the healthcare system to be able to withstand the impact of climate in our healthcare and in our environment. So for example, my colleague Shelisa mentioned about changes in the pattern of disease, disaster management, disaster plan recommendations as well. For example, we know of the rainforest fires in Brazil, in Africa, and in some parts of Australia as well. So there is it's important for us to think about climate adaptation. How do we make our practice to be more resilient, to be more robust, to cater for the impact of climate, and to be much more prepared to keep on improving health outcomes in the midst of climate crisis. So this includes for us to not just leave disaster planning to the government agency. We have to put some systems in place in the area of practice, to mitigate disaster, in case of disaster, and be more prepared. Because during disaster, like fire outbreaks, that's when a lot of demand and pressure on the healthcare system. So we need to be much more prepared in the area of practice and consider disaster plan to make sure that health outcomes of the population we serve are not affected by any climate issues. So we need to strengthen our supply chain and minimizing shortages. So in terms of stock management is very important because, for example, during tropical fires or like in the rainforest in Brazil, you can imagine the fate of cold chain products like the insulins and other cold chain vaccines as well. So the fires kind of affect the integrity and the quality of the product, and they might even be and not be able to be effective again. They might lose their efficacy. So we need to strengthen our supply chain systems and make them resilient to such climate-related disasters in our communities and in our country or regions, as the case might be. So ranging from the procurement, the storage, the distribution. So we really need to make sure that they are resilient. And they don't need to have to be too complicated or too robust, but at least we make sure that in our only two way, in our own area of practice, that is resilient, and at the same time advocate at the national or regional level for a national and a more effective supply chain system. Then we also need to, another part of the scope is to, of course, always ask ourselves the question of what's the impact of climate on our health and medication management. So again, for example, during, let me go back to the issue of rainforest fires, whereby clearly there will be high rates of demand for people with burns, people with, different degrees of burns. So we need to factor that in. So if our region or our country is very prone to these kind of climate-related disasters, we need to stock our medications to be prepared and to be taking proactive steps to handle whatever healthcare demand that might be put on the system when such disasters occur. Next slide, please. So these are some examples of the medications that we need to review in terms of how they impact the environment. And of course, looking at how the heat as well affects them. So as I mentioned earlier about insulin, whereby fires as well, because they are cold chain products, so they can be destroyed by fires and the efficacy reduced. So medications that interact with it as well. So not just them, you've seen antidepressants as well, our CSRIs, the TCAs, and central nervous system stimulants. So this list is not exhaustive, but these like the common drugs, our everyday drugs we see. So whenever we are trying to consider climate adaptation, in terms like heat, and in terms of changes in weather, rainfall patterns, and those kind of things, we need to factor in the type of medications and understand how our medications, what their fate will be, or how the safety and the efficacy will be during times of climate disasters or climate unwanted climate issues might arise in our environment. Next slide, please. So still on our adaptation, so I've mentioned earlier that natural disasters pose unique challenges to the practice of pharmacy, as I mentioned earlier, as they can lead to significant disruptions in healthcare services and access. So and in this case, remember, pharmacies are like the first point of contact, community pharmacies in this case, for the public. So because we have that closer relationship with the people compared to hospitals. For people, it's easier to see the pharmacist than to see the doctor in a lot of countries and a lot of regions. So we have to understand what our role is in terms of being more disaster prepared, and to ensure that we continue to deliver our obligations to the patients in terms of medication, prescription refills, dispensing prescriptions, and managing medication inventory. Just imagine in the case of disaster in your country, in your region, and there are some people who are still struggling with prescription refills, like diabetic patients. Of course, those pharmacies need to meet those demands while still being resilient and tackling the issue of natural disasters. So there is need for accurate medication management. So emergency supply distribution, patient education is very paramount. So because the patient healthcare system is very much strengthened when the patient is educated and informed, because they will help as well, working closely with the pharmacist to ensure that healthcare services are available to everybody as at when needed. So it's very, very important to ensure the effective emergency and disaster management preparedness, which I've mentioned earlier, and response to professionals should be tailored to their specific province and professional judgment. So, of course, we mentioned we have different areas of pharmacy practice. So we have to make sure and advocate for each area of pharmacy practice adapting their disaster preparedness for climate adaptation, especially that aligns with their key organizational objectives or their key goals in terms of medication distribution or manufacturing, as the case might be. So we have to ask ourselves the question of what's the impact of to evacuees. So, for example, in health disasters, people are being evacuated. So what is this impact, to evacuees, and what is the impact to our pharmacy operations and services? Although definitely during times of disaster, of course, pharmacy operations will change and the mode of working will change. So there is very, very important need for pharmacy to be much adaptable and flexible to meet the healthcare needs of the people during disaster. Next slide, please. So having said that, just to remind all of us, I'm sure a lot of us have seen it, the FIP policy statement that was launched last year at the FIP Congress in Brisbane. So it outlines what different aspects of pharmacy practice can do to mitigate and also adapt to climate in their areas of practice. So it's very, very holistic document. So if you haven't really seen the document, I would really recommend that you take a look. It's very comprehensive and straight to the point. There are some recommendations that you can consider as well to make your area of pharmacy practice to be more resilient and to be much more sustainable as well in the quest to mitigate climate and also, of course, adapt climate as case might be. So this is just for the hospital pharmacy, as you can see here. There is need for collaboration, working with healthcare teams, working with anesthesiology teams, which I mentioned earlier, to review the type of anesthetics we dispense to use for surgeries. Review distribution and dispensing process. I mentioned earlier about supply chain, which is very important. Then, of course, waste disposal is very important, ensuring that you dispose pharmaceutical wastes like cytotoxic products, ensuring that they are very much well disposed. Then you limit single-use medication devices. So I mentioned earlier about disaster plans. So of course, these statements strongly encourages that you have to be regular updates of disaster plans, because it's always very good to be proactive than to have like a fire brigade or an emergency plan when you're not prepared. So always preparation is key. It's very important. Next slide, please. So this is just a continuation of all other aspects of community practice. Initially, the previous slide was about hospital pharmacy. So you can see here about our colleagues in the industry, some certain steps that they can take in terms of mitigation and adaptation. So this is just like snippets from the policy statement. So it's more comprehensive than one you see on your screen. So I really encourage all of us to review these documents, and it's like you to give us like a good start to ensure that we mitigate climate and also adapt our area of practice to climate to adjust to the impact of climate in our areas of practice. Next slide, please. So thank you so much. I hand over the floor back to you, Ruben. Thank you.
Thank you, Shima, for this nice presentation, also the different parts of mitigation, adaptation, but also the FIP resources that are available. And I'll ask Hanadi if she can put the link to the statement on sustainability on the chat, because it is indeed a very complete document that has a lot of suggestions and recommendations and a lot of good things in there. So, and it's a great work from the team from last year. So after these presentations, we'll now move on to the panel discussion. So I'll briefly introduce the panelists. So we have Mina A. She's Chief Sustainability Officer's Clinical Fellow on the Southeast London Integrated Care Board, United Kingdom. So welcome, Mina, to the discussion. And we'll have as well Naoko Arakawa. She's Associate Professor, University of Nottingham. She's also part of the FIP constituency. So thank you very much, Naoko, for joining today's discussion. And we have Angelina Lim. She's lecturer at Monash University, Australia. She's joining very late in the evening. Thank you so much, Angelina, for joining. So I'll ask everyone now to turn on their cameras. I'll stop the presentation so we can all be together on screen. And I would like to start with the first question on what, from your experience, what are the key environmental challenges that the pharmacy sector is facing, and how can pharmacists contribute to addressing these issues? And I'll probably start with Mina on this one.
Thank you, Ruben. So the question was, what are the key environmental challenges facing pharmacy sector today? So I suppose when everybody look at environmental issues, immediately come to mind is waste and packaging. But actually, when we appraise our data carbon footprint in the NHS, waste and recycling issues is only about 3%, maybe at most, of the whole NHS's carbon footprint. So waste and recycling is a small section. It's not important, but I think that's one of the things that people go to first, and because it's visual, you see the waste, and we're so wasteful. I personally think the biggest issue is ignorance and the lack of awareness of the climate change, kind of the science behind it, as clinicians, how this is applicable to us as a healthcare professional to advocate for a more climate action. And how pharmacy need to change a lot of the practices. And I've met so many pharmacy professionals who doesn't think that this is their problem to solve. They're only one person. What's that got to do with them? Why do they have to go through these efforts to make all these changes that cost money? It doesn't directly benefit them. We're already so busy. So that is quite a big danger to implementing any climate action. So I think somebody said before, I think it was Chima, in the UK, pharmacists and pharmacy technicians make up the third largest healthcare professional in the UK. So collectively, actually, we can make a huge difference. So it just takes one person to start the movement bottom up, and one person to start implementing sustainable strategies top down. Then we can implement change from a little start. And the other key issue, I think, is a behavioral change element amongst clinicians, especially clinicians who's been, practicing for 20, 30 years, who's just refusing to see anything different from what they've been doing the last 20, 30 years. how do you change that attitude and beliefs? And we need to start reviewing. I think Chima covered it perfectly in his slides as well. The pharmacy procurement activity and the existing activity we undertake in everyday practice. Why do we need to wear gloves to give IV medication? You don't need them. Why do we wear gloves and aprons to vaccinate our patients? You don't need them. Stop wasting healthcare resources unnecessarily. And they are all attached to carbon footprints. So if there's no paper, I can't find a paper out there still that says that you need to wear them when undertaking this pharmacy clinical activity still. So it's just having a sustainability lens to review our existing pharmacy activities is what I want probably say one of the issues in tackling this.
Thank you, Mina, because we're indeed a lot of us in the healthcare setting and in the pharmacy sector. So if we all do a small change, then probably there's a big impact out there. Thank you so much. Naoko, I'll go to you and then Angelina.
So thank you, and thank you for the very informative presentation first to the key speakers. As I think I cannot agree enough with the Mina's what she said about ignorance as well as the challenges in the behavioral changes. I think the challenges from my part is that probably the education from myself as a FIP education secretaries, that I think the education for the future pharmacists to understand these issues before coming into the practice. So that's from the day one, this sustainability issue should be the norm in their practice. That is also what I really think it's a challenge at the moment, because I think the education is really packed at the moment. To bring the sustainability is quite limited in space, but we really have to map these sustainability issues in the clinical practice so that we can actually keep putting the sustainability up front for the students, but also putting into the continuing professional developments so that existing the workforce actually raising the awareness about it, so that we can with the confidence we can communicate these scientific issues with the other healthcare practitioners as well as the patients as well. I think I would like to also go for a call for the scientists as well as the pharmaceutical industry to think about the carbon footprint of the medicine manufacturing, because I think the trying to reduce the cost of the manufacturing so that we actually transport all medicines all over the world. But sometimes I think the local productions and manufacturing all these medicines that sometimes reduce the carbon footprint. So we have to think about these issues globally together, so that we can reduce the all carbon footprint of the pharmaceutical use all over the world as well. Thank you.
Thank you, Naoko. Very interesting. And I'm seeing a question in the chat is that if there are any research results. So this is also a very important part to measure, to show some figures to understand how pharmacists can be involved as well. So thank you so much for that note. Angelina, go to you now.
Thanks, Ruben. Hi, everyone. I just want to echo what Naoko and Mina was saying with awareness. So I'm coming from the university perspective, and I want to shout out to Catherine, who's on the call as well. So we're trying to integrate it in our curriculum in every part of the course, that there is a planetary health, and we're co-designing it with students as well to get them involved. And hopefully that will start the foundation, get the habits going, awareness, and it becomes part of their day-to-day practice where they're consciously thinking about it. Even something simple, when we're trying to think of things, obviously pharmacists are very time poor, a lot of competing tasks. So we're thinking of simple things they can do. So one of the projects we're doing is just teaching pharmacists just to de-label false allergies, penicillin allergies, because we've noticed in one of our projects, 30% of the penicillin allergies in community pharmacy were false. So it's just a tummy ache, they can have penicillin. Otherwise, these patients go into hospital, say they have penicillin allergy, get a broader antibiotic, and like Shalisa said, it goes into the waterways, biological excretion, as well as potentially improper disposal, which Renee and I have also found in some of our projects, the advice that patients aren't aware of return to unwanted medicine bin and returning your unwanted medicines back to the pharmacy, and they're disposing it themselves or putting it down the sink. And sometimes pharmacists are giving the advice to pour it down the sink as well. So maybe just creating some more awareness of little things that they could do in their day-to-day practice to help.
Thanks, Angelina. So awareness as a big word there, not only for the pharmacists or the healthcare force, but also for patients, because I can relate. Even in my hometown, I see medicine management, and sometimes I get angry with the family, but it is what it is. So the context is there, and it's important to raise awareness there. Thank you so much. So Shalisa, going back to you, maybe you want to link also with the 3 areas, and you want to elaborate a bit on that? Thank you.
Sure. Can you recap the question for me?
Yeah, so what are the key environmental challenges? What would you say those are the key ones?
Okay. So with regards to environmental challenges, I would say that, again, I would emphasize Mina's point with regards to really looking at where emissions specifically are coming from, and then looking at your own specific background that you're also coming from too. So I know that there was a question, for example, on pharmaceutical manufacturers and what they can do. Looking in on, is this a batch versus continuous manufacturing type of approach? Where are throughout your line, are you thinking about manufacturing at different facilities, and then one in one area, and then one kind of a big geographical distance away, or do you have kind of a more continuous line? The second would be are there renewable energy is there renewable energy being incorporated within facilities as well, which is really important too. Cold chain, trying to look at, how do you look at reduced emissions within the cold chain, within transport as well. I think that if we were to think more broadly to climate adaptation outside of mitigation specifically, I think, the number one thing I would emphasize is looking at disaster planning, whether it would be on the hospital pharmacy side, the community pharmacy side, the industrial pharmacy side. And then I know Chima was talking about medication management as well. So when we're thinking about something like heat, are we thinking about, a patient is on lithium? What are the considerations with regards to the fact that it's a very narrow therapeutic window? When a patient's on a diuretic, are we thinking about increased renal impairment as well? So really trying to, as kind of Angelina was also mentioning, trying to think about incorporation of both climate mitigation and adaptation within the curriculum, so that this is something that students think on a regular basis, and then also something that we also think about within continuous pharmacy development as just another part of the way we work. Environmental sustainability is very linked to economic and social sustainability. It is economically smart for us to be prepared for disasters. It's economically smart for us to be able to reduce our emissions. So when we're thinking about environment more broadly, and we're trying to make a case to other people, really trying to think about, what are those people going to be interested in, and really talking about that issue accordingly. And just, it's the same issue, but you're just basically bringing up those additional lenses as well, particularly from a social perspective with regards to equity as well. So thank you. That was a bit of a long-winded answer.
Thank you. No, it's there's no key issue, right? There's a multiple lines of issues that are interconnected. So it's not as easy as saying we solve this and it's gone. But it's interesting. For example, the heat issues. I can see my dad has insulin pen, and in a very hot summer days carrying in his pocket and walking around. So I can understand simple issues, but then of course this has an impact on the medication management. And going to Shima, we also have a question in the Q&A box about the aerosols, but what would you say are the key environmental, before I go to you, Shima, if any of you want to reply to the Q&A, you can also type the responses to our participants. That would be appreciated. So Shima, now to you, key environmental issues. What do you have to say?
Yeah, I think my co-panelists have said it all. In fact, for me, the education part is very, very important because you really need to convince people, you really need to speak to them, you really need to make them to understand, both pharmacists, healthcare workforce, and the patients as well. But one key area I also think that is very important is the lack of political will, not just for the government, but also for the pharmacy regulators, because I feel like when they make these laws and kind of make and lead from the front, because you don't usually the pharmacists on the street will say, "Oh no, I shouldn't start this." Like what Mina was saying, we need everybody to take that lead role. So I know that if the pharmacy regulators or the government is kind of making it their priority, saying that this is the way we should go, I think everybody has to fall in line, right? They'll be like, okay, why is government? I'm making the case why it should be. So for me, the lack of political, which I can understand, like you mentioned, Shelisa, about the relationship with the socio-economic perspective of it. But again, the government or the regulators need to understand that you're not looking at the instant economic benefit, because the manufacturers will say, oh, if we don't consider climate now, we are making money profit now. But they're not thinking about what's the profit in the next 10 years, in the next 15 years, what's the impact going to look like. So we should stop, kind of make the case why you should stop looking at what's the instant gratification from the social and economic perspective and look at long-term and leading the way. I think for me, that's one of the key challenges outside of ignorance and education. Thank you.
Thanks, Shima. It's indeed way easier to see the profit now and not think on the profit on the longer scale. That's a very nice note. So moving on, I'll ask another question is what opportunities exist for pharmacists to positively impact planetary health and address climate change? So what can pharmacists do? What are the possibilities over there? And I'll start with Naoko this time.
Thank you. So opportunities, let me think. So I think the first of all, if we think about the advancement of the role of pharmacists, and I think we are more and more involved in the prescribing. For example, in the UK, I think we have to ensure that the prescribing medicines with the consideration of the sustainabilities. So we had the project. I was a part of the project led by Professor Sharon Flegger in Scotland. We did the project on the sustainability prescribings in collaboration with some environmental scientists there, especially for the water environments. So, the many medicines actually excreted into the water, 30 to 100% of the active substances of the medicines. So we know that many medicines are actually coming into the water, very toxic active ingredients as it is. So we have to think about the toxicity of the medicines, even without wasting, actually using effectively, but they're still affecting the environment. So we have to think about this toxicity before prescribing, so that we can support that environmentally, but also clinically benefit to the patients and the oceans and the environments, supporting the planetary health. But also, I think as a pharmacist, probably in some countries who doesn't have any prescribing rights as a pharmacist, we should be able to communicate these scientific evidence with the public and the healthcare professionals. So I think the pharmacists have a great opportunity to communicate effectively, looking at all evidence and actually in later on that we can actually raise awareness, but also support the effective use of the medicines in patients.
Thank you, Naoko. And that was a very nice thought, because when I was working community pharmacy, even when I was dispensing, I was not aware of the the environmental issues of this box I'm dispensing. So that's a very nice thought to have. Like being aware of this point is very interesting. I think I'll go now to Shima. Shima, what are the opportunities? What would you say? Also, following your presentation, you already presented some, but what do you say, like top priorities or top things we can do?
Yeah, for me, it goes back to the awareness campaign, right? I strongly believe that not a lot of people across the world, especially like in the global south in Africa, where I'm come from, the issue of climate change and healthcare system is quite low. Like what Mina said, a lot of pharmacists will tell you, it's not my problem to fix. So why are you telling me to fix this problem? So trying to make them to understand what they can do and how this relates to their area of practice. And I still go back to a policy statement that FIP has done. I think that's something we should promote, and creating educational programs to educate people and make advocacy. Advocacy is very important as well for so because it's just pharmacists are taking the first step, I believe, but we still need to bring in other healthcare providers that are not non-pharmacists and the public as well. So advocacy is very important. Having this what's it called, interprofessional collaboration, because a healthcare system is not just pharmacies in silos. We need to work with our colleagues across board and ensure that we have the impact we make in the healthcare system to make it sustainable is quite felt. So I think these are like the key areas of priority we should be focusing on now.
Thanks, Shima. A very nice note also on maybe in the low and middle income countries, the issues are slightly different from the high income countries. So that's also a very nice note and nuance to register. So I think I'll go to Mina now. Mina, what would you say are the main opportunities that we have?
I think the main opportunities is depending on which country you're in and what challenges are uniquely to your local. So the easiest way I can explain this, for example, in UK, which is just the same example that Ruben you've given about your dad and insulin pen. So UK, our hospital wards, we don't have aircon in most of them. And with global temperatures rise, these hospitals are not built to adapt to climate change. So we're storing medicines on our wards, our hospital wards, in a bedside, outside recommended storage temperature settings, right? We're using these medications off license, off label, where we're not monitoring the temperatures on the ward at all. What we're going to do about them? So in Asian and Middle East countries, for example, the traditional hot weather countries, they are better adapted already in healthcare settings with, air cons installed. So they have less of this. This is less of an issue to them as a pharmacist. In those countries. So it depends on uniquely what your local challenges are. And I'd just like to address some of the questions asked as well in the Q&A from the audience. So in terms of pharmacy procurement, so we're talking about plastic packaging waste and inhaler propellants that's been produced by industry that are not green. So how you can influence this is also depending on what type of pharmacist you are. So for example, if you're working in procurement, can you implement sustainability criteria in your procurement of medicines? In Helsinki, they've done this. Denmark and the Nordic countries, they've come together and implemented environmental life cycle analysis data requests from suppliers to say, how green is your product? Show me your data. Increasingly, if the more people ask for that data, then pharmaceutical companies are obliged to produce them, and be frank and transparent about what they're producing. So if you're working in an industry pharmacy, so I think Chima outlined the evergreen suppliers framework in the NHS in the UK that we have. So we are saying to all suppliers globally, in I think it's 2038, I can't remember the timeline now, if you do not have a carbon reduction plan, if you do not have a net zero commitment, we are not trading with you anymore. So a lot of big pharmaceutical companies currently already have the plans in place because as part of the ESG, they've done this for environment ethical reasons already, but additional production of carbon reduction plan, almost creating like a carbon competition. So traditionally, we're procuring drugs based on, the prices, availability, but increasingly, loads of people are also evaluating the carbon element, environmental impacts in terms of the procurement. So I think then that all comes into play when you're deciding on which products to use that are greener, for example. And if you're a frontline pharmacist, you're less likely to influence the supply chain because you're frontline. However, you can counsel your market, these people, the patients that are using the drugs, about lower carbon options. The inhalers is a really good example. So loads of people are being told now, propellants currently, the market ones, have got higher global warming potential. So the patient are making that green choice and mandating pharmaceutical companies to do something, because they're losing business. Because if they're not, upping their game, loads of more patients are going to demand for the other products that are lower choices when they become more aware. So there's loads of ways you can influence. It depends on where you sit in the system in pharmacy, and also what country you're in.
Thank you, Mina. That's very interesting, because if the patients want that product, then the market will shift to those types of product. That's also very, very interesting. Thank you so much. Shaliza, maybe you have some thoughts on opportunities, but also focusing probably on the manufacturers following this line of thought.
Yeah, so we have in Canada, we have tried to take a lot of tips, specifically from the UK, and I can see that we are also kind of now starting to move forward. Because we have provincial healthcare systems, it's a little bit different than something like the NHS, but we also have these group purchasing organizations that work with the manufacturers more broadly, and they have incorporated one of the two major group purchasing organizations has now incorporated a scorecard which has that percentage weighting with regards to environmental sustainability. So I think it is coming. Sometimes a lot of us, I don't work individually in industry, although I have, I know broad strokes as to how industry can reduce emissions and have read industry emission reports. Sometimes a lot of us in hospital and community are thinking, okay, well, seems very far away with regards to industry, even though procurement has a really high emissions footprint. So what can we specifically do? So one thing that we have found that is really effective is basically coming together. Mina is part of a group called Pharmacy Declares, and co-founded that group, really focusing in on advocacy. In Canada, we started the Canadian Association of Pharmacy for the Environment. But even if you're not starting this big, a nonprofit specifically, coming together with different pharmacy colleagues, let's say in a committee or wherever you can, to really, send messages specifically to individuals that are involved in procurement, to say, okay, we're really concerned about this, and we're concerned that this is having an impact on our patients, and we would like to basically see change in this area. I think can be very effective. I'm also very cognizant that we are right now talking to a very global audience, and between mitigation and adaptation, sometimes adaptation might be because of just how vulnerable the healthcare system is, or the fact that the country itself produces a lot less emissions for certain countries. Adaptation might also be a really big priority for certain groups as well. But if we're thinking about industry specifically, think about challenging on supply chain resilience, for example. That's an issue that is global, but it's particularly a challenge when you have one road and to a particular healthcare facility, and if that road is disrupted, then you're really in trouble, right? So think about your inventory management, and then also think about how would you advocate specifically with regards to supply chain resilience in order to try to minimize your stockouts as well.
Thank you, Shaliz. And maybe taking the note on getting together, maybe a note for the pharmacy organizations, the FIP members, that I know that some of those have started to grow some sustainability working groups inside of them. So maybe that's also a very nice starting point, even if it's a small group, but it's already on the agenda and people are already talking about it. So I think we'll have Angelina for what the opportunities, maybe on awareness, maybe on education. What would you say are the opportunities?
I guess there's been a lot of high-level talk, so I guess I'll talk to what the everyday community pharmacist and hospital pharmacist can do. Even just like Chima said, health promotion, you use your shop front. As you said, in this talk, pharmacists are freely accessible. People visit the pharmacist quite often, once a month mostly. That's somewhere where you can do some promotion of planetary health and teach the public to keep an eye on their habits and also their medication management. You could also manage stock control in the community, and not just the medications, the vitamins, not just the prescription ones, but even the over-the-counter ones, to making sure you don't have a lot of expired stock, and not having too much stock. And also, when you give out your medications, you're giving the right amount. And in Australia, we're now making sure with antibiotics, we're just giving them exactly what they need to reduce wastage. In the hospital front, obviously, a lot of the antimicrobial stewardship pharmacists will be advocating for IV to oral switch to reduce the packaging associated with giving an IV medication compared to an oral medication. So little things like that, I think they can all help reduce the wastage from a ground level, and also something to help with promotion. Yeah.
Thank you so much, Angelina. I'm just noting that we have a couple of questions in the chat as well. So Mina, one about the temperatures, for example, if you can provide some notes. So I had two questions, but I'll merge those two into one. Okay, so I'll have one question for all of you about education and then collaboration, and then I'll ask each one of you also for a final message. So I'm aware of time and that we'll have to finish in about 15 minutes. So I'll join these two questions, and I think I'll start with Shaliza this time. So what are your thoughts on training opportunities that are needed, and also collaboration opportunities, advocacy? So focusing a bit on these areas. So I'll go to Shaliza and then to Angelina again.
Okay, so the question is about collaboration and collaboration opportunities and advocacy opportunities more broadly.
And also training opportunities, if you have any thoughts.
Okay, so yeah, multi-part. So I'm going to try to split it into three parts. So the first question, I think for training, we're at a very exciting time with regards to pharmacy school training specifically. There's a lot of different universities that are now incorporating environmental sustainability, climate change mitigation, and adaptation within pharmacy education. I'm part of a wider team that is focusing in on a scoping review on looking at climate change, mitigation, adaptation, environmental sustainability within pharmacy education more broadly, which is really exciting, and a poster should be out within the next couple of months as well. Really, this is becoming part and parcel of pharmacy education, and different accreditation bodies are now, depending on the country, starting to look at, let's mandate specifically that climate change has to be part of pharmacy education more broadly. In terms of collaboration and advocacy opportunities, they differ. So I do work on I'm fortunate I kind of have a foot in different areas, or a hand in different areas. So think about local, national, and then international collaborations and advocacy. If you're thinking about locally, think about your own hospital, whether you can create an environmental sustainability pharmacy committee and bring people together there, and then work on advocacy in that sphere. Nationally, or if you think regionally within several countries put together, you can think about coming together, posting on a forum, asking if individuals want to come together to discuss, how to create a small body that can help move various players forward. So we have done that specifically with the new Canadian Association of Pharmacy for the Environment. And if you search caphe.ca, you can see how we are structured, and our strategic plan and our annual general report are out there. Internationally, FIP has done some great work, particularly with the policy that came out. And I know that there is an exciting kind of time ahead, specifically focusing in potentially on, for example, cafes for potential collaboration that way. But really just looking at within your own section, within your own area, what are the opportunities to come together with people? Somebody mentioned multidisciplinary here, and I can't emphasize that enough. So both multidisciplinary from thinking about pharmacists with pharmacy technicians, thinking about healthcare systems, multidisciplinary within, physicians, nurses, other allied health professionals, as well as thinking about, I just go to something called green drinks every month, and there's engineers there, and they are like, oh, pharmacy, there's pharmacies at the table, so they're very surprised by that, and we get to talk together about the big buildings that we live in and or we work in, and there's some really interesting overlap in areas of advocacy there too. So the more we can be there at the table, the more we can be there at hospital tables as well, representing environmental sustainability within pharmacy, the more we're actually funded as well to work on this work, which is really, really important as well. So yeah, again, kind of multi-part, but I hope that makes sense.
Thank you, Shaliza. Yeah, unfortunately, we don't have more hours to talk about because I would have many more questions for all of you. But it's interesting that the World Health Assembly just ended and pharmacists were there as well. Present FIP was there, so I think that message is very important. If you're not there, you miss the opportunity, and other healthcare colleagues will take those opportunities on. Thank you so much for that thought. Angelina, back to you. Any training, advocacy ideas you want to share?
I just want to have a concluding remark. Yeah, that there is training being done in the undergraduate sector, and I know more and more universities are taking this on. And there's also, so we've got integration. And actually, that came from the Faculty of Nutrition, and we actually liaised with them, and they are actually going to set up a whole platform from different faculties about their learning activities and sustainability learning activities that we can all share. So there's those platforms in the university, and it's getting more and more innovations are coming out. There is I think actually there's the Planetary Health Collaborative Online International Learning group for pharmacy students as well. So the students definitely, there's going to be a lot more. There's the Planetary Health Report Card that they do. In terms of the profession, perhaps using some of the continuing professional development activities and those sessions as a place where you could mention it, or whoever's giving a talk could mention an aspect of planetary health. As Mina said, sometimes to reach out to those who have been in the profession for a while.
Perfect. Thank you so much, Angelina. And it's important to have the continuous professional development, CPD. So we have the provision program in FIP that aims to also give food for thought on that, because it's not, I done my university and that's done. I don't need to think about anything anymore. We actually do need to think about different things, and it's an area of growing interest as well. So I really noted it down. Thank you so much. Mina, now to you. Any training, advocacy, ideas, thoughts?
Yes. I suppose there's a document I read recently that's really good in WHO. It's about empowering health professionals to tackle climate change. That's published, I think, in March. So it talks about don't use jargons. So, for example, if you're starting off in this climate health sphere, when you're trying to get people on board and understand, the context, the science behind it, don't use things like, oh, this inhaler is 20 kilograms carbon dioxide equivalent. What does that even mean? Is that better than a flight? And then I recently even discovered some pharmacy professionals that can't differentiate between dry powder and, pressurized meter dose inhalers as well. So simple things to start with. Don't overload people when you bring them on board, and be specific about, the policy or you're trying to change. For the last 20 years, it's been like this. Why suddenly we're having a change in practice? Understand your audience and the local context as well. So when I've sat through so many presentations about climate change and health, and they don't tailor it to local. So they present loads of global statistics, global climate injustice issues, not relevant to an everyday healthcare professional that's seeing patient front line, a community pharmacist, a hospital pharmacist. So know your audience who you're speaking to. Use local statistics like, 10 of your community pharmacies I've identified that's near you is going to be flooded in 10 years' time because of sea level rise. And your patients will not be able to get medications from this area and this village. What are you going to do? So like local example to get people to think. And then tell people about the stories as well, personal stories. Why are you on this journey? I am on this journey because X, Y, and Z. My children, a lot of people say that. And then when you also bring patient stories, which I often do in my presentations. I always give the one where 2 summers ago in my hospital ward, I went to do a medication reconciliation on a patient, and she said she wants to go home. You wouldn't treat a dog like this because it was so hot on the ward. She cannot function as a human being, you know. So then that brings to home that this is going to be an ongoing issue year on year with record-breaking temperatures. And if it's like a financial team you're trying to get on board to fund your sustainable projects in pharmacy as well, talk about money. Don't start with this is a environment project, you know, to try and get people on board. So a good example would be the nitrous oxide waste reduction project. You know, if I were to bring it to my exec level and chief pharmacist, I would say this project will save you £25,000 every year. By doing that, it's also save this much on the environment, and also this is what I need. Be very specific in your ask. Everybody's busy, and to focus about, you know, the health benefits that it brings to your patient as well. Because ultimately, we're doing this for health. We're not doing it, you know, for personal reasons or because I believe in this. Nobody cares what you believe in, really. So why are you doing this? As a group of healthcare professionals, get to the point.
Thank you, Mina. Very important to frame and be specific on what we're going at. Thank you so much. Naoko, now to you.
Thank you. I think many things already mentioned in the group. So probably I think it's just the right touch from the different perspectives. So I think I would like to encourage our pharmacists and the pharmacy students to communicate these issues with the very good confidence with the patients and the healthcare professionals. For that, I think they really need to have the critically applies the evidence, that the ability to do that, but also the communication skills effectively to do that, because I think in this post-truth era, many people believe in different theories, different issues, and different religions. I think they really need to understand their backgrounds and with the empathy that they have to be able to communicate these sensitive issues sometimes, but also with very good confidence, so that they can actually advocate the importance of the planetary health and the impacting on us as a human health as well. I think but also I want to just talk about also some research collaborative opportunities for pharmacists and the pharmaceutical scientists. I think we need to use the effective involvement of the public and the stakeholders in the research, so that we can make the significant impact directly to the policymakers as well as the stakeholders, the evidence for better planetary health. I think that often some we ignore some part of the stakeholders, and we really have to think about the better stakeholder mappings for the research to involve the wider stakeholders and the important key stakeholders in there. I really love the multidisciplinary or transdisciplinary research and the collaborations. I often bring just thinking aloud my ideas about the research and talking to the other people beyond the health sectors. And so that's I now collaborating with the environmental scientists, the climate modeling scientists, and many other scientists beyond the health sectors, which bring the bigger significance into our health and the policies as well. I think we have to be able to communicate these issues, and I would like to bring this communication issues in the education better in terms of the climate change.
Thank you, Naoko. It's true that as pharmacists, sometimes the role of focus on pharmacy, and there's a whole range of things we can also do. So Shima, back to you, and then I'll ask you all for one sentence as a final message, because we'll need to close. Thank you, Shima.
Yeah, so for the training opportunities, I understand, of course, like what my colleague in Monash University mentioned about changing the curriculum, including climate mitigation and all in the curriculum. I also think that you can even start from where you are. For example, you can talk to your colleagues. That's like the easiest part. For example, people in this that who attended this webinar today. That will be like a first step. You tell your colleague, have you heard about climate mitigation and adaptation, and how can you apply that in our day-to-day work? So you become the first line of ambassadors for the issue we have been discussing today. So not just the whole official curriculum. So it starts with us, everybody on this call, people who have heard about climate change, people who have heard about planetary health, and also it starts with you. So I think that should be explored, because we are not too small. You don't feel like your contribution is insignificant. You can go a whole lot way. Just imagine if all of us as pharmacists talk to one person each, like every week. Before you know it, all of us will become, we'll all become champions, and it will become very much, when you say collaboratively impactful at the end of the day. So I think that's one opportunity we should start with. Speak to your colleagues, speak to your patients. It's very important. That's for the training, and of course, explore the official avenues like the FIP cafes, which is upcoming, the curriculums and all, but the informal discussions really goes a long way. Now, in terms of advocacy, one option that has not really been explored significantly, I think, is the young people. For example, the ECPG, the YPGs in your local pharmacies, because they are because you're talking about, they are the young people. They have the drive, they have the momentum, they have the push to champion this. So I think we need to leverage on working closely with the young people, the ECPG, the YPG, both at FIP level and at our local, national and regional levels, to help champion the issue of climate change. And like Mina mentioned, like, you can't tell a pharmacist who has been practicing for 20 to 30 years to change, but it's easier to tell a young pharmacist to change because they're still new. They've not really been formed in their way of thinking and in their way of approach. So that's very, very important for us to champion advocacy. In the issue of fostering collaboration, I think is very important. Shelisa mentioned working with our colleagues, different organizations, pharmacists being in the room when these discussions are being done. Like you mentioned, Ruben, during the World Health Assembly, pharmacists being there. So in such discussions, pharmacists being part of these discussions, working with other stakeholders, not just within the healthcare system, but also other climate groups, identifying each climate groups in your country, in your region, and identify with them, go work collaboratively and work with them to be able to champion climate change. I think those are the three views I have on that. Thank you.
Thank you, Shima. We're running over time, so I'll ask each of you for one sentence as a main message, and then we'll need to wrap up so we don't steal anybody's time. So I'll start with Shalisa. One main idea, one sentence.
Sure. I'm going to go a little bit out of left field, and I would say hope is important. A big threat to all of this is a sense, like in some populations, and us in general will be at some points will be a time of kind of despair or sadness, and just maintaining that layer of hope that this can, like, we can do this is extremely important.
Thank you, Shalisa. Shima, one last message, one last idea.
We can, let me echo what Shalisa said. We can do this, and it all starts with us as pharmacists on this call. We can make that change in our own little way. And don't be feeling bad or feeling like you can't do it. You can. A little change matters. A little drop in the bucket can make an ocean. So let's do what we can, and we can make the world a better place. Thank you.
Thank you, Shima. Very positive message as well. I'll go to Angelina for a final message.
Yeah. Echoing Shima's, spread the word, and just even doing something and someone watching you do something will help, perpetuate the good habits.
Perfect. Mina?
Ask for forgiveness later, don't ask for permission. We haven't got time to wait. Pharmacists are the most risk-averse group of people that I've ever worked with. So I know, don't wait for your SOP, your terms of reference, just do it.
Thank you. And Naoko?
So in addition to the all message, I would like to open arms from the FIP. If you feel isolated and think about climate change and climate health, please come to the FIP. We have a lot of colleagues who can support you.
Thank you, Naoko. A very positive message that FIP is here also as a table where colleagues can participate, share, discuss ideas, and just learn from each other. So wrapping up, we'll have some videos that are on our sustainability page. You can see some examples from different colleagues. In Costa Rica, they have medicines collection, for example, community pharmacy in Spain that use some solar panels in his pharmacy. So we have some videos that are to celebrate this World Environment Day, and you can find them online if you're curious on watching them. And of course, we need to talk about the 82nd World Congress happening in South Africa. So from the 1st of 4th of September, the topic is innovating for the future of healthcare. And we have some topics on equitable quality healthcare, innovating drug discovery and access, and AI, of course, are the three big topics of the program. And this recording will be available in FIP Digital Events. Would like to thank everyone for their time, for their contributions. You can watch the recording later and also share with colleagues this recording in this page. And again, thank you very much, everyone. And I stole a bit more of your time. But again, it was a very interesting discussion, and look forward to seeing you all again in another sustainability related event. Thank you.